Attention all anatomy aficionados. This is the anatomy of the elbow. The elbow is the region between the upper arm and the forearm that surrounds the elbow joint. The elbow includes prominent landmarks such as the olecranon, the cubital fossa, also called the chelidon, or the elbow pit, and the lateral and the medial epicondyles of the humerus. The elbow joint is a hinge joint between the arm and the forearm. More specifically between the humerus in the upper arm and the radius and ulna in the forearm, which allows the forearm and hand to be moved towards and away from the body. The term elbow is specifically used for humans and other primates, and in other vertebrates forelimb plus joint is used. The elbow joint has three different portions surrounded by a common joint capsule. These are joints between the three bones of the elbow, the humerus of the upper arm, and the radius and the ulna of the forearm. When in anatomical position, there are four main bony landmarks of the elbow. At the lower part of the humerus are the medial and lateral epicondyles. On the side closest to the body, medial, and on the side away from the body, lateral, surfaces. The third landmark is the olecranon found at the head of the ulna. These lie on a horizontal line called the heater line. When the elbow is flexed, they form a triangle called the heater triangle, which resembles an equilateral triangle. At the surface of the humerus where it faces the joint is the trochlea. In most people, the groove running across the trochlea is vertical on the anterior side, but it spirals off on the posterior side. This results in the forearm being aligned to the upper arm during flexion, but forming an angle to the upper arm during extension, an angle known as the carrying angle. The superior radio-ulnar joint shares the joint capsule with the elbow joint but plays no functional role at the elbow. The elbow joint and the superior radio-ulnar joint are enclosed by a single fibrous capsule. The capsule is strengthened by ligaments at the sides but is relatively weak in front and behind. On the anterior side, the capsule consists mainly of longitudinal fibers. However, some bundles among these fibers run obliquely or transversely, thickening and strengthening the capsule. These bundles are referred to as the capsular ligament. Deep fibers of the brachialis muscle insert anteriorly into the capsule and act to pull it and the underlying membrane during flexion in order to prevent them from being pinched. On the posterior side, the capsule is thin and mainly composed of transverse fibers. A few of these fibers stretch across the olecranon fossa without attaching to it and form a transverse band with a free upper border. On the ulnar side, the capsule reaches down to the posterior part of the annular ligament. The posterior capsule is attached to the triceps tendon, which prevents the capsule from being pinched during extension. That's all for now. Thanks for listening. Please comment and subscribe. Thanks.